Yes, 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 yes. Peace. I'm gonna say peace, 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 and more peace, and more peace, and more peace. So, this is your brother Wujau. Um, it is very late at night or very early in the morning, and I know it's very late. I'm going live completely out of the blue. Hopefully to have a late night open discussion because I know a lot of us are on a lockdown type of schedule, not really doing much, and spending time at home and things like that. So I figure I would have a late night, see who's up, and have a late night conversation, open discussion about the coronavirus, um, and get some feedback and have some discussions on how everyone's handling the outbreak, what's going on in your city, what's going on in your town, your city, your neighborhood, and just kind of kick it, for a while tonight. So if anybody's up for it, I posted the link inside the chat. So I'm gonna do that again, and everyone is more than welcome to join the panel and be able to speak because I want to hear what's going on in your area, in regards to the outbreak, how you're handling it, and what's going on, how others are handling it, and then to talk about the coronavirus itself. The virus itself is SARS-CoV-2, and then the disease that it causes, COVID-19. So just want to have some discussions on that, all around open discussion. All right. So I just went live, and anybody who's already subscribed to my channel and has turned the notifications on, they'll probably be notified. If you're up, come on, join us, join in on the discussion. If you work from home now, maybe your job, has you working from home and whatnot, you could work your own hours. Then a lot of you may still be up. And then we have the West Coast. It's 1:19 a.m. my time, which is East Coast, Eastern Standard Time. So the West Coast, you have 3 hours. So let's go ahead and kick it. So I'm gonna repost the link. Let's just dive in. I don't have any presentation or anything to share or show. Just want to have a discussion. I think we should have these kind of discussions. Check in on each other. For one, and then get some intel, get some 411 on what's going on around the country. Hear it first. Live and direct from you all. So let me find this link and post it into the chat. All right, don't be afraid. Join the panel. Click on the link. I just posted the link. I appreciate anybody who's tuned in. Listen, I'm going live out the clear blue sky, clear night sky, and just waiting for you all. I would sit here and just talk you all to death myself, but no, I don't want to do that. So don't be shy. Don't be afraid. Come on in. Come on the panel. You don't have to have your camera on. I know it's late. People probably laid up in the relaxing. So yeah. So again, for those who may tune in, all right, peace to Zane, Indonesia, 5,000, Vyasa Hotep, peace. Emiket, peace. So click the link, join in. Don't have me sit here talk to myself, y'all. I just want to have a discussion. I want to find out what's going on in your area, how you handling the outbreak, how you handling the closures. All the sports have been suspended or canceled. School closing. You can't gather more than 50 people and things like that. How are you handling it, and how are other people handling it? How are your grocery stores and shops doing? Because there was a impulse buying frenzy and hysteria that was going on. People buying up everything. So just join the panel and let me know. I'm being nosy. I think this is a good thing to be nosy about right now. because this is new. This is new for a lot of us. This is very new. I don't remember in my lifetime something going down like this. Even though we had SARS and MERS prior, but it wasn't like this in terms of awareness. And we could talk about that too. Why does it seem um, why does it seem different and all that good stuff? So I'm gonna post the link again because I see nobody jumped in yet. And see, I think you all want me to talk to myself. Y'all gonna force me to talk to myself. Oh, we have a couple people. Brother Sheffrin, Jolanda, aka Juju, Vyasa. All right. So I mean, I'm opening the floor. Y'all can grab the mic. So this is gonna be a cipher, just an open discussion, and the umbrella topic is the coronavirus, how you handling the outbreak, how what's going on in your neighborhood, and we could talk about the virus itself and what we should be aware of, because there's a lot of misinformation out there, but there's a lot of good information out there too, and so it's a soup of a mixture of all kinds of things. And so I guess a little later after we kick it off, if we start this cipher, my sister is a nurse practitioner or nurse. She works in urgent care. And so I had a good discussion with her the past few days. And she shared a lot of information with me, and she's on ground zero. So she's dealing with patients. She's in the urgent care, like I said. So she's seeing people who suspect themselves as being infected, coming to get tested and all kinds of things. So I could just share some of the things she was saying and explain it to me. So, okay, so this is a cipher, like I said. The mic is in the middle of the room. Just walk up to it, grab it. The floor is all yours. So I'm not going to kick it off this time. So y'all know the topic. Who's up to the mic first? Be like, what's his name? That song Symphony. Was that Molly Mall?
Yeah.
With Cool G rapping and all them. Yeah, get up to the mic. And hey, I done forgot the lyrics, boy. But anyway.
It's gassed up. I believe that's me.
Yeah.
Jump on the mic for the symphony.
There you go. So I guess Sheffer, you got the mic first. There you go.
Oh yeah, man, it's crazy. I mean, most people ain't never been through nothing like this. Far as wise everything shutting down and the coverage of it. But I feel like people that I know, well, I own a barbershop and I work in there, so I feel like people ain't taking it serious. You know what I mean? Like, as far as wise the social distancing, um, the amount of people that's still trying to come to the barbershop. You know what I mean? It's like, what are y'all doing? Like, half of y'all is off work. Um, and then in the barbershop, you gotta be close to people. You know what I mean? Like, to get your service. It's just it's kind of where you don't want to be the one that's overreacting in your circle. You know what I mean?
Mm-hmm.
It's like you don't want to be the one that's acting creepy, but you know something wrong with it, but you don't want to be the one that everybody be like, because here everybody like, man, you need to chill out. You know what I mean? Like, you believe everything that's on the news. I mean, this thing kind of, if you start seeing the NBA shut down and you start seeing movies not getting put out, getting pushed back, like these companies are risking their money, you know what I mean, to shut this, you know what I mean, to shut their businesses down, malls closing, and y'all actually think that it's not a serious issue. You feel me? So, like, I've been the one that's been very cautious. But then for my social circle, and business circle kind of look at me kind of crazy when I'm shutting down the shop early and, going home and your clients calling you like, can I get an appointment? But I'm really not giving them appointments. You know what I mean? Just because I don't want people piling up in the shop, so it's kind of hard dealing with it. You know what I mean? When the people in your business circle is not really taking it serious.
Right.
You know.
Yeah. I think that's kind of widespread, just judging from the flood of memes that I've been seeing on Instagram and on Facebook. And, I know that people will joke regardless and things. Memes are funny, but if you judge by those, it seems like that's kind of widespread. People not taking it too serious, and also because of misinformation out there. Some people think it's a conspiracy. Some people think it's a hoax. It's a lie. It's many different things. And plus a bit by we don't know what it's like. Like I remember being real little. Everybody and their mother had chicken pox, or got chicken pox. So chicken pox back then was normal. Like it was expected that you get it. Like it wasn't odd, everybody had it. And now the generations after that and whatnot, they didn't have to deal with, all those things. So they might not have a point of reference. They might not have a reference point to see the seriousness of it or how things spread or what this all means, So that I think that's contributing to it as well. Because I wouldn't have been I use the chickenpox example because I didn't see when I was little or younger. I didn't see chickenpox as anything. Like it was normal. Like, hey, you get chickenpox yet? No, I ain't get it yet. It was like, you waiting. You looking at the clock. Be like, all right, I'm gonna get it any day now, and it was nothing. You just stay home for a while, wait for the chickenpox, the sores to dry up, then you can go back to school. That's how it was. So, or the best thing, ringworms. People getting ringworms, and they're highly contagious until they dry up. But that was it. So I don't know. I don't think people would understand what it is, coronavirus. Then you have people saying that the virus already existed because they could see on old Clorox, Lysol bottles, and things. They could see where it says human coronavirus. On those say, it's a conspiracy. See, it was there all along. Not understanding that it's a family of viruses. But yeah, I don't want to talk too much. I don't know who else. I'm gonna keep posting the link for a bit. See who else want to come in here and just share information about the maybe what they've seen on the news updates or what's going on in their neighborhood. Because I know as far as the United States, the epicenter was on the West Coast. Seattle, Washington, and California. They had the highest numbers of infected people. And now that I might as well say this. Now that the nation has, the president has declared a national emergency, which frees up funds for different things, more tests are being made available. And now more people who suspect these symptoms are being tested. And so the numbers are increasing of those people who test positive. And so, which means that there have been people walking around that may have been asymptomatic, meaning they don't express any symptoms, but they're infected, and the virus during the incubation period, you can spread it. And the spread rate is one person can spread to three. They estimate 3 people, which is exponentially high. Where the regular flu spreads from 1 to 1. And these are numbers that they refer to as RO factors, RO numbers, and things. And so people may not even understand that. And it's an exponential issue where 1 can infect 3, each 1 infect 3. And so if 1 does infect 3, those 3 can now infect another 3 each. So it becomes 9, you know, and so it increases exponentially, which is how fast and how rapid this can spread. And people are testing positive to where they don't even know how they came in contact with it, and that's even dangerous. People are popping up, being reported, but we only see the reports, like as far as headlines, when somebody famous or somebody significant in the media test positive. So I know I just before I went live, I saw one of the congressmen, somebody in Congress tested positive, and then a couple of others. And so if that's the case, they'll make headlines. But there's a lot going on. The numbers increase. I know in New York, I believe the numbers doubled. I don't want to misquote, but there's some report about New York. The numbers in New York went up real high within the last 24 hours. But it wasn't because people caught it all of a sudden within 24 hours. It was because now more people are being tested, and they're getting the results, within 24 hours. I mean, within that time frame, and now it's increasing those numbers. So yeah. So let me post this link. But yeah, anybody else? Want to share? Anybody else want to share?
Yeah, I was just gonna say that I know that most people are still joking about you know coronavirus and how it doesn't affect Black people, and then by the time Black people started getting infected, then they started talking about, oh, we are not dying yet, and it was just a little iffy because at the time that people were talking about it, me personally, my family on Sunday, we knew somebody who actually died from coronavirus this Sunday, and he's from Ghana, and he was I think he was in 60s, 62 or 63, and he had passed, and he got infected in the hospital. He was in a ward, and I think he had a blood clot, I think, on the lungs and the brain, and he was getting treatment, and I think he got infected. He didn't even last 20 hours, and during that time, people are talking about doesn't affect Black people. It doesn't, people, or at least if it does, we're not dying from it. Those were just like stuff that most people would talk about that if they're not really directly, then they don't know somebody who's directly infected or not, and that was a lot of ignorance. And the other thing that I saw was when I think Bill Gates talked about it's gonna affect Africa the most, and people they still didn't understand that, but they don't understand, the kind of how things are set up on the continent, and then also in the Caribbean. There's a lot of the ghetto is like it's not the same ghetto. The ghetto people living in zinc fence houses, and like your neighbor, the sewage coming from your neighbor's house goes directly sometimes through your house and the other houses, and people have to step on those kind of stuff. So those are the things that when they talk about it affecting Africa, and Africans being affected the worst, those are the kind of things that people don't take into consideration. How when the disease starts spreading, how it can really spread exponentially, and in those areas where there's no cure, it can really blow up to like the proportions like we've never had. Even Italy might just be something that is like that's nothing compared to how it will affect people on the continent when it comes to that situation where it's starting to spread in those numbers. But those are the things that when somebody like Bill Gates talk about it, people take it the wrong way. They don't understand that whole how the system works.
All right. So yeah. So again, for those who tuned in, this is a out of the clear blue, clear night sky live. I just wanted to go live and really just check in with anybody who was up. Wanted to have a discussion about what's going on in your neighborhood, your city, your state, and how you're handling or dealing with the outbreak, and the different changes you may have to go through So we just passing the mic around, and I see people jumped on, jumped off, may come back, whatever the case is. It's could be a revolving door for a while. Not gonna stay too long, but it's just open for anybody. I posted the link if y'all want to come in and share any information. So I'm gonna put the mic back in the middle of the room so anybody can grab it. I know Zane. We have Sister Amber. Say peace to y'all. And
Yeah, I got something to say, but I won't be on here for long, kind of sleepy. But what I'm getting from this, it kind of feels like Y2K. You remember how Y2K when they was telling everybody to be prepared,
yeah,
telling them everything that they need, but it wasn't like a state emergency, but like social media at that time, what it
mm-hmm.
was. They were just telling everybody to prepare for whatever is coming at the end of the year.
Yeah,
It was like around the whole world. That was like I
yeah,
want to say a social pandemic,
mm-hmm.
but it's like comparing that to the how that is now. It's like with social media now and this virus, they're telling people, hey, the information is like I want to say it's like multifactual, but it's not like just facts. It's just more like the information is varies more than what it used to back then. Now it's like you have you have the accurate information, but you have like several other false narratives, and that's just like one or two. You have maybe like four or five. They're telling you, you know, they're telling you medical information that's wrong. They're telling you, demographic information that's wrong. You know, it's kind of hard like now than it is back then.
Yeah, yeah, and that's an interesting point you brought up though. With Y2K, the internet wasn't, as they say, lit up the way it is now.
Yeah, it was like the
Because
birth of social media back then. It was like the beginning stages.
yeah, exactly. So the internet wasn't like didn't come out available to the public until what 1993, 95, and somewhere around there. And so by Y2K and stuff. So, but now this is interesting though because imagine if Y2K, if it was a Y2K situation right now with the way social media is now, man, I think it would be chaotic chaos. I
Yeah,
mean,
it's
a lot of the
crazy.
fake news, misinformation, people having access to people in real time. I mean, it would be. I think it would be like crazy out here. It was Y2K. But anybody else? Because again, I was just gonna share a couple of things that my sister had shared with me as far as information about the virus and what she's dealing with. She's in urgent care, and so she's dealing with people who suspect themselves of being infected. Coming to get tested and things like that. And so her working in doing that, she has to keep up with the latest data and dealing with folks and things like that. So I'm just gonna share some of the things she was saying. But before I do that, I'm still gonna pass the mic around. So Sister Amber, if you like,
Yeah. Peace to the panel.
all right, peace.
Um, Emmy Cat said
Appreciate it.
something that was like very interesting to me. So, not this past weekend or the weekend before that. I want to say it was maybe about 2.5 to 3 weeks ago. Um, my mom called me and told me that my son's father was in the hospital. So, when I spoke with him, I'm like, because I had literally just seen him like a few days before. So I was like kind of confused, like, well, in the hospital, what's going on? So when I talked to him, like he was talking really shallow, like he could barely like speak. So he ended up texting me that he had blood clot on his lung. And they were telling him that it was probably he had a blood clot that traveled from somewhere else and just kind of ended up in his lung and that's why. So he ended up pretty much, she was like sick with like what he thought was like a cold for a few days. And then he really started having difficulty breathing like 3, 4 days in. So that's when he went to the ER because the people he was around, like he was around cousins and stuff, and he was just like really struggling to breathe. So they took him to the ER. So they ended up admitting him to the hospital. He stayed there for about 3 days. They said that it was nothing that they could actually give him. They just kind of had to monitor him and see if his body started to absorb the blood clot. So then he ended up being released. So during this time, I didn't really know what coronavirus symptoms was. The announcement had been made about the virus, but I didn't know anything about symptoms. I didn't know anything about testing. And I think that maybe we didn't know a lot about that either, like, health professionals. So when she mentioned that, it just kind of struck me that somebody died from the virus and they had blood clots on the lungs. Because now in my mind, I'm thinking, did he potentially have the virus at that stage and they didn't have the testing available to see if that's what it was? And they're just assuming blood clots on the lungs, this is just something that transferred and traveled through your body, and this is what it is. So in my mind now, I'm kind of like, what was that? Because he didn't quarantine after that. He returned to work and he been out and about. So it's kind of weird. I don't know. That kind of just gave me a little pause when she mentioned that.
Oh, yeah. So it wasn't that he had symptoms of that. He was in the hospital. He was actually in the ward. He was in the hospital since December for the blood clot on the brain and
Developed it while he was in the hospital.
yeah, and then he must have been infected. They don't know by who, but he must have been infected by either the people visiting the hospital or one of the nurses. So when he got infected, he didn't last 20 hours after the infection of coronavirus.
Oh, okay.
So then he just died within 20 hours of being infected.
Yeah, so this thing should be taken serious, and I see the memes and stuff, like the quarantine and chill, get your quarantine bay and stuff like that. And I think people can make light of it to kind of suppress the hysteria. So I get it, but I would, there's there needs to be an education. There needs to be people looking into this and following, and I guess even knowing where to follow. And I'm saying the CDC, if you go to YouTube, I think everybody's YouTube video has like a CDC link underneath of it by default now. I think Google has set that up on the CDC website. And when you log into everything, pretty much it kind of provides you with the link to keep up with or to educate yourself on the virus and the updates and even the stats. Like there's some websites that have stats on, as far as the numbers of reported infections, people who were infected versus fatalities. They show maps where you can see the demographic of that, even the age range and things like that. So, it's something that we should take serious, and people are downplaying it and all that. But you always want to err on the side of caution when it comes to life and death type of situations, especially. We shouldn't be bothered by erring on the side of caution. If you're wrong, I'd rather be wrong out of caution than to not exercise caution and end up being wrong on that side. So I think we gotta take it serious. And so, in talking with my sister, she was saying that and she's in Georgia. So here in Georgia, they have tests that they can administer, and they swab your mouth and do whatever, but it takes approximately 72 hours to get the results back. But as of yesterday, they were waiting on a new set of tests to come in terms of a more faster turnaround. You get your results the same day. But now here's the thing. There are people who are in urgent care, in hospitals, in the ER and things for other conditions, and diseases or need treatment. And so what happens is people who don't know much about what's going on, people are flooding these places to get tested. So then it becomes an issue of turning people away from being tested. And because of the nature of the virus itself, that's very difficult to do because some people are asymptomatic or they show minor symptoms. And so if it's a flood of testing being done and they allow it, then the staff, the resources and everything is dedicated to that. And then people who are in the hospital for other conditions that were there, all along, or people coming in, the regular traffic that a hospital gets, it starts to bottleneck. And so that's the curve that they talk about. They need to keep a certain amount of this activity in hospitals and things under a certain number. And so that's something that she was saying that they have to battle, because you don't want to turn somebody down from being tested and they end up, being one of the infected ones. So you almost feel compelled to test everybody who comes to be tested. And that can be overwhelming, as well. So that's a fight. That's a battle that all medical centers and hospitals and things have to deal with right now, all across the country. So you have that going on. And then people are trying to compare, like another thing that's going on. People are focused on death. Like, what's the death rate? Like, how many people died and stuff like that. Not realizing that nobody wants the flu, like, let alone die. Of course, nobody wants to die, but this is not like nobody goes around and wish that they catch the flu either. The flu can be devastating. The regular seasonal flu can be devastating. And so the coronavirus, there's no treatment. There's no cure, no vaccine. And so if infected, it has to take its course. And that's not a experience that anybody wants. So, but people are focusing on dying, as if that's the litmus test for it. Like, okay, well, the death rate is still under 2,000, so we good. No, that's one too many, 2,000 too many, or whatever, And so that is something that has to change, where people are looking and comparing, and they're using that and they're comparing it to the flu and saying, well, over 10,000 people, close to 20,000 people have died in the United States, have died of the flu in the United States so far this year, 2020. And they're like, only a certain amount of people have died of COVID-19. And that's a wrong comparison or correlation to try to make, because the flu, way more people are infected by the flu than the coronavirus. So not knowing how to work those numbers, your numbers will be skewed, or your idea about it will be way off. And so that is lending to people's behavior. So I think Sheffrin, he's not here now, but he was saying that people kind of lax about it and everything. And that's because of that. Oh, well, the death rate is not, whatever. And then the rumors, black people can't get it. And then when black people get it, then it's black people are not dying from it. And then you show somebody, a black person that died from it. Then it's like, crickets at that point, but it's crazy. So anyway, I don't want to talk to death. Maybe somebody else had Vyasa. I know you on.
Yeah, and I apologize about earlier. My Wi-Fi dropped. Y'all kind of covered a lot where I was going. I was going to speak on that privileged mentality that we developed as a culture, and how it almost has separated us in a parallel way of looking at things through my eyes, from historical people to now. It seems like people in the past depended on each other to produce ideas for situations like this. We're depending on ideas to produce the people, in a sense. Everybody wants to pawn this off. It's not my responsibility, or that's white people problems, or that's a China thing, versus not even realizing the privilege of being aware that these things are taking place. And you're taking it for granted, a big part of the population, not the people here, but hopefully y'all can understand where I was going. And then when y'all was speaking about the death rate, I don't know where I seen it, but one of the doctors was talking about the comparison to um, this COVID and to the flu and said it's a 10% higher death rate in the COV right now compared to the flu. And he said the death rate is only at 1%, but that's still 10% higher than the flu. So people shouldn't be making that comparison. If I can find that source, if y'all haven't seen that doctor that was speaking about it, I'll see if I can dig that back up from
Yeah,
earlier.
that would be good because I know it's point one
Yeah,
compared to what you were saying. So yeah, and that's what I mean. So people are seeing the numbers, but they're not interpreting them correctly,
yeah,
and that's contributing to this as well. And plus, people got to understand exponents, the exponential spread of it. And so, like I said earlier, one person is said to be able to infect 3 people. And so if one person infects 3, each one of those 3 can now infect another 3. That becomes 9. And then those 9 can do 3 apiece. And then it spreads like that. And so how it spread is that because there were some rumors that it may be airborne. And so there's no confirmation of it being airborne. I think measles was, as they call it, aerosolized or aerosolized. Yeah. Um, that was spread through air. It actually travels with the air current for a certain period of time, and they consider that airborne. If I'm not mistaken, it's measles. I know it was something in the past, but this one is not like that. This one spreads on what they call respiratory droplets. If you cough, sneeze, in the air, it falls to the gravity is gonna fall to the ground, but it can spread and fall slowly within a 4-foot range around a person. They say 4 to 6 feet. And so, and if you're in a closed-in area where there's no circulation and you got a closed circuit of air, then coughing or sneezing in that situation can spread infection. And so that's how it's spread. It's also spread by a person touching a surface where a person has respiratory droplets and it fell on some surface, and depending on the surface will depend on how long it lasts. So paper, plastic, glass, and things like that will offer different times that the virus will survive and be infectious by touching it. And so if you touch it and then you touch your nose, eyes, or mouth, then you can infect yourself. And that's pretty much where the face masks come into play in terms of the touching part. But the respiratory droplets, a lot of face masks are not really equipped to block out those small microbes and things like that. So we have to understand all these things. And so that's why they say that people shouldn't gather of more than 50 or more people in any particular location, because of these 4 to 6 feet of this respiratory droplet cloud that you can create if you cough, sneeze, and so on and so forth. That's why they say cough in your elbow, almost like they're telling you to do the dap, and everything. Basically, you cough or sneeze, so it will go into your fabric of your shirt or whatever at your elbows or whatever the case is, And another thing is that the virus attaches. The reason why it attacks the respiratory system, but it attacks the lower and the upper respiratory system. And one of the things about this virus is that it will damage your lower respiratory system, lower lungs, and cause scar tissue. I forget the technical term for it, and that could be permanent. So it's not something that should be played with. And one of the reasons, and it's it actually lodges itself in your gut area as well. And the reason for that is, to my understanding, is that we have these receptors called ACE2 receptors, and the virus latches on to those receptors, and it's in your pulmonary area, which is your lungs, your heart, and your gut. And so that's why people are having these symptoms that they have. And until your body builds up these immune cells, these lymphocytes, leukocytes, and things to fight it off, T cells to actually fight off infected cells and things. That takes time. But in the meantime, the virus is trying to replicate and proliferate in your body in these areas. And so that's what's happening. So your body has to fight it off. So that's what they mean by the virus has to take its course, because there's no cure for it and no vaccine for it as of yet. And so these things that people have to understand. Just like the flu. Now, luckily with the regular flu, people get the flu. We have over-the-counter products, Thermaflu, and things like that. And what that does, it reduces the time frame of you having symptoms and things. But it still the flu still takes its course, but it reduces that time frame. So it's a big helper. It helps to reduce that environment where the virus can spread. So all these things people have to keep in mind, and they're locking down things. Now here's another thing. Children or minors, people are under 18, are what's called perfect carriers. And a perfect carrier is a person who is asymptomatic, but they're infected and they can pass the virus, spread the virus to others. One person per 3 people. And so minors are what's considered, like I said, perfect carriers. They either have no symptoms, which is asymptomatic, or very minor symptoms. And then if they don't know that they are infected, they could pass it to other people, 1 to 3 again. And so the closing of the schools and stuff, I know I've heard people say that, they feel like that was overreacting and stuff like that. But no, if you were on the board of education, or you were a principal of a school, and one of your students got infected and it was become fatal and they died or whatever, that would mess you up. If you're in an administrative position when you could have closed the school and things like that. So these are precautionary measures that these people are taking, and we should applaud that, not play it down. Even if there are no fatalities, these minors, as they're saying, are perfect carriers. They can spread it. And you talking about, if they didn't close the school, we talking about a wide spread, a quick spread of the virus at that point, because you have a bunch of young minors, children, walking around carrying it, infecting their household, which parents are older, grandparents may live at the house, go visiting somebody, and this and that, and it'll be spread way more than what we have right now. So anyway, I know I'm talking a lot, but I posted the link. Listen, I appreciate anybody who tuned in right now. We're just having an open conversation about the coronavirus. And by the way, the virus itself is called SARS-CoV-2. It's a relative of SARS. All right. And SARS stands for respiratory system. I forgot what the acronym is for, but I think somebody can look that up real quick. But that's the name of the virus. COVID-19 is the disease. Okay, so and some people are getting confused, but they're, because people use it interchangeably, at least everybody knows what you're talking about. But just to be technical, if you're going to do research, then it matters. Those two different names matter. But in just conversation, everybody knows what you're talking about. Or you could just say Corona. Some people even short it to Rona. So-and-so got that Rona. So, everybody knows what you're talking about. But when you do that research, make sure you understand the differences in the names. But yeah, so the floor is open back up. I'm gonna post a link again. Anybody want to jump on? And basically, I just want to hear about how people are handling the outbreak. I know I'm in Georgia. All the counties closed the schools last week. And this is another thing that my sister said, that based on the information that she's aware of and everything, she doesn't see anything getting normalized back to normalization no earlier than June. and that's how she feels right now, and that can change. But she was saying that she said when they first announced a 2 week thing, like 2 weeks, 14 days and stuff, she already knew. She was like, nope, that's not real, and then it switched from 2 weeks to 30 days, which is 4 weeks, and now it's 8 weeks in terms of kind of self quarantine. What they call it, what they calling it now, anti social,
I
whatever
think they call it social spacing and I think self quarantine.
yeah, there you go, social spacing. So they're saying exercise social spacing for 8 weeks now. You know, um, social distancing. There you go, social distancing and social
Okay.
spacing. Yeah, they're saying keep that up for 8 weeks now. And so what she was saying was, nah, she don't even see that. She said, June, the earliest that she says June, because what happens, and I asked her why, and she was saying that it's based on this curve. I forgot what it's called, but it's the capacity curve of the hospitals and medical facilities in the country as a whole, and they have to get below that number, and right now they're not. And so it could get worse in terms of trying to care for people and things like that, because the staff has to have a means to protect themselves, and then if they didn't, then they have to quarantine, if they suspect themselves of being infected, and then the equipment, money, time, all that stuff. So yeah, anyway, so mic is back open. So I see some more people in the chat. Kofi, the watcher. If y'all want to jump on, I put the link in.
Yeah, so out here they just canceled school. They did it on Sunday. So Friday, and I'm in Minnesota, Minneapolis to be exact. On Friday, the governor announced a peacetime state of emergency, but they were kind of hell bent on keeping schools open, which I had kind of made up in my mind I wasn't going to send my kids to school.
Mm.
Um, and then Saturday they were still kind of like on that same page, and then Sunday um, he mandated that all schools be closed, start beginning Tuesday until I believe April 6th. So, and then, if you opted not to send your child to school Monday, then the absence will be excused. So, they finally mandated that all schools be closed, but there were some areas where schools were closed. But it's a little weird to me that people are okay with not having to go to work or um, rushing out to the stores to buy all the tissue, but they complain about their kids not being in school, and that's an overreaction. Um, I just think that's a little strange. Um, but what I will say is, I had read online that the symptoms, when they do kind of show up in children, that they show up a little differently. And I believe this was on the CDC website, that some children experience like vomiting and diarrhea as a result. So now they're starting to look into maybe gastrointestinal symptoms as also being a part of the diagnoses, because I believe it was on the CDC website where they were saying people, it was like some people who had kind of the virus had passed through their system with like I guess other tests like respiratory tests. It wasn't showing any sign of it still being in their system, but days after it had passed through their system on other tests, they were still finding traces of it in their feces. So they were saying that, like you said, it buries in the gut. So I'm not sure if that's what you were kind of talking about, but I had read that they were saying that they're starting to consider that maybe that may also be um, a symptom in the future. They're trying. I guess right now they're testing it because they say some people have gone in with vomiting and diarrhea. So I guess they need to do more research on that.
Yeah,
But
that's okay.
I did want to ask, do you know, or is there like a standard for how accurate the actual test for the virus has to be? Like, how often is a positive given when it's not, when it's actually a negative? Like, what's the margin of error?
Yeah, that's a good question. I asked my sister that, and they right now they're waiting for a new a type of test where they can get the results back within the same day. So I don't I don't have that information, so I don't know. But like I said, people should err on the side of caution though. And what's weird, not weird, but what's more challenging, I should say, is because the overlapping of this outbreak with allergy season, and then we're coming to the end of the regular flu season. So right now,
Mm-hmm.
people are may have symptoms of the regular flu or infected, and then allergies. Like I have allergies, and so I'm like, man, I'm not trying to play. I gotta make sure I keep my regular allergy, things I go through every year. I have allergies all my life, so I know what to expect. I get allergies twice a year, spring and the fall. So whatever blooms in March and April, and then something else that blooms in September, it gets me. So yeah, I will make sure I keep those things distinct and everything. So I'm trying to make sure I'm careful and everything. So, but what you were saying about the gut, what you could look up is called ACE2, ACE2, and the ACE is an acronym, stands for angiotensin converting enzyme, and we have receptors in our body in the, like I said, in the lung area, in the gut, in those two areas mostly. And so that may be related to what you were saying earlier, where they having those kinds of reactions to it. So you can look that up, angiotensin, or ACE2. If you look up ACE2, I think when you look it up, if you because it's ACE2 in animals and humans, so make sure you look up ACE2 in humans or ACE2 and go in the right direction. But maybe that will
Yeah,
shed
I
some light.
think I found it. I googled it right quick.
Okay, matter of fact, I just let me see. There's a wiki article on it, and it actually says ACE2 has been shown to be the entry point into human cells for coronaviruses, including SARS-CoV, the virus they call SARS, and now we have SARS-CoV-2, which is the coronavirus that causes the condition called COVID-19. Yep, it's in the first paragraph. So yeah, check that out. And see, this is what people need to know and understand. That's why I wish people in the downtime, people should educate themselves, because I'm gonna tell you, panic and hysteria has never solved a problem, ever. It's created problems. It's always created more problems, and we got to do what we have to do. But hysteria and panic has never solved problems. And that's another thing that people are rumoring around, martial law. And I don't think people understand what martial law is if it were to be declared, because we just see it in movies and people joke and talk about it and whatnot. But I don't think people really understand what it means to be under martial law, number one. Two, they don't just declare martial law out the blue like that. Martial law is almost like a last resort type of situation, and it's dependent on the civil unrest, basically. So if martial law is ever declared, it's because of the people, not the government just doing it, because they have stages. So first, before martial law, they may per state, they may have a curfew or citywide curfew, maybe a statewide curfew first, and stuff like that before they enact martial law. And then if the people start to loot stores, if crime goes up, if people get robbed of different essentials and all this other kind of stuff, people acting crazy, then it may escalate to other things, ending up being martial law. So that people have to understand that. And I know recently the National Guard has been deployed, I think, in 6 states I believe it's up to 1,000 people and personnel, and that started a big rumor, like martial law, and things like that. But if people were to just read the National Guard's official statement on the website and stuff like that, you'll see what they're being deployed for and their duties and all this other kind of stuff. It's not what people were spreading around. And so it's things like that we have to really push people to do. And unfortunately, people are not, they're not doing it. So again,
Yeah,
I
that
don't.
was another thing.
Oh, I'm sorry.
That oh, I didn't mean to interrupt you, but that was another thing that I was gonna mention because my sister is she's technically active, but then she's actually a reserve, so she's a reserve with the active position. So that makes her active, but she was telling me the other day that there's a lot of talk about them being deployed, and she's in Maryland currently. But because I know kind of what they typically do, I'm not like I don't feel like it's martial law, like I just know that when there's a crisis, you know, they typically deploy National Guard as support, you know what I'm saying, for a variety of reasons. Like she deployed to Hurricane Katrina when she was in the military,
Mm,
So I mean, I just kind of understand that uh it's not her making sure everybody in the house and not going anywhere and raiding. I just know that that's not the case. So it
right.
doesn't really bother me. It just kind of lets me know the severity of the situation.
Yeah, that's a good point. And like if people were to read this latest deployment, they would they would read what you just said. They because they're being deployed to assist the medical facilities. They're being deployed to provide facilities and resources for um, quarantine people because they have that place to go because you got to remember ventilation because a hospital, of course, hospitals are built certain floors, maybe certain wards of a hospital specifically for infectious diseases and things, but they're limited. So the National Guard is a resource to aid and the local whatever's going on locally and things. Martial law would be a different ball game though. So people are confusing and mixing the two, and they just gotta educate themselves. It may seem that way. I know we like watching these movies and things, but um, we gotta. I know one thing: the hysteria and panic never solves anything, and that impulse buying that people did. I don't know. And then what people were buying. It's like people were buying up toilet paper so much so that it became the joke now. The toilet paper. You see the memes everywhere. Toilet paper. I saw one. It had Lionel Richie's album cover where he's like kind of laid to the side like Michael Jackson's album cover, and he's holding a box of Charmin, and and he had the lyrics to his song, "Hello, is it me you looking for?" or something, um, stuff like that. But at the same time, the the aisle where you see Thermaflu and vitamin C and vitamin D and all that kind of stuff was fully stocked. I'm like, man,
Mm-hmm.
y'all going to the wrong things. Like what? And push come to shove, man, you got water in your hand. You could wipe yourself. I mean, you better get
And
those
that was what was
supplements.
odd to me. I'm like, so people just not gonna buy soap and they just not gonna take showers, so they just gonna tissue for everything. Like, I mean, worst come to worst, you can bathe. Like
Yeah.
what's wrong with taking an extra bath, an extra shower, but you're not gonna get anything to really help you. I mean, I'm literally seeing people stock up on Miller High Life, like no lie. I seen
Wow.
so many people bringing in liquor into my building. I was just like, really? Like, are y'all serious?
Wow. Wow. That's was it Corona?
Miller High Life, hard liquor, lime maritas.
they
I didn't see any Corona,
they're
but
not
I was
touching
just,
that
I just
Corona.
couldn't believe. I couldn't believe people was really like taking runs to the store to stack up on liquor. I couldn't believe that.
They're not touching that Corona. That Corona beer. It's too much like coronavirus. Oh man, that's
I
crazy.
spoke on that earlier about the toilet paper. I'm never gonna be able to grasp this. Here it is, people sneeze, it causes a panic. I'm not taking away from the virus. I'm talking about people's behaviors. They rush out to buy toilet paper for a health aid, but your entire life you've been warned about STDs and condoms are always on the shelf. I'll never understand that. Um,
Hmm.
I don't. It goes to show the irresponsible culture that we really are breeding throughout the world at the moment. So I think this is going to be a huge wake up call for a lot of people. That's what I hope comes from this more than anything. I'm glad people are aware of it and we have these fields of study, but I hope it actually wakes people back up. You know, we spending too much time looking at these screens and not enough time looking at the reality that we alive. And that can be taken away just as fast as your cell phone can die. So
Yeah,
I'm gonna chime back out.
and speaking of hogging stuff and things of that nature, I read somewhere, and it's just a question. I read somewhere that regular I read somewhere that the regular soap is better than sanitizer, works better than sanitizer. And I know that most people have been hogging a lot of sanitizers. And then with the fact that you have to be quarantined in the house, because I understand that sanitizer is good when you're out and about because you can carry clean your your hands with soap and water when you're out and about. But a lot of people were hogging a lot of sanitizer while at the same time you have to be quarantined or self quarantined in the house, which means you probably would be needing more of liquid soap and things of that nature.
Right.
But I did
Antibacterial
read
and
that it
yeah.
was better than sanitizer, so I don't know if you want to talk about that.
Or even that people is buying sanitizer, like you'll buy the $3, $4 sanitizer, hand sanitizer, but you won't buy the dollar bottle of 90% alcohol. Like I don't know.
Yeah.
It's just a little weird to me.
Now it becomes a fad. Like everybody saw that's what was taken, and then it's bandwagonism. You jump on the bandwagon because you feel like you don't want to miss out, and that's how we kind of been conditioned, or we conditioned ourselves to be, and so that's part of it. And I experienced it the first night, the first day. I went to the grocery store, and I noticed going into to the grocery store, walking in, is usually the shopping carts are right there at the door. There's a lot of them, and there were
$5.
none. It was none. I was like, man, what? And this is before I got in the grocery store to see how crowded it was. So I'm like, man, where are the baskets? So then I walked back to the parking lot to grab one. You know how they got the place where you put it near your cars. I looked in those things, none. I'm like, whoa. So I walk in there, and sure enough, it was like club grocery store. It was everybody in there, people wearing masks, long lines. Um, I was like, wow. And I mean, everything wasn't bought out, I guess, because I caught the first wave of it, I guess. But I was like, man, did I miss something? So I had my cell phone, and I started looking online, pulling up things that there's something that, something come on the news that I don't know about, or whatever. But yeah, that was impulse buying. That was happening right there. People buying toilet paper and water, and water is essential. I understand that. But I walked over to the supplements aisle where the vitamin D, E, and all the vitamins and stuff, and that was full. I was like, man, something. Am I missing something? You know?
I mean, but is it too much like right to just buy a filter
Yeah,
for your tap?
right. Exactly that too. So yeah, so it's kind of weird. So this experience, but now on the positive end, I have seen people literally become a little more health conscious right now. I've seen people do a little research and become, uh, I guess I would call it, immune system literate. To learn about the immune system and things. So, I have seen an increase in that too. In terms of what I see online and stuff like that. So that's a good thing. but it's not. It's the misinformation or the hysteria kind of overpowering it though, in a downplay. And then you have the anti. Well, I guess the pro-vax and the anti-vax conversation is really mute at this point because coronavirus, there is no vaccine. So the anti-vaxxers can't argue against it because it don't exist, and then the pro-vaxxers can't argue for it because it don't exist. So that conversation needs to be dead. Anybody that brings that up or brings up that that so-called debate that happened a while back, that's just a waste at this point, because even the people who believe that the virus is man-made in a laboratory versus those who don't, that's a dead topic as well, because when you ask, and I've done this, you ask the person outright, whether you believe it's man-made or not, do you want it? And everybody will say, no, I don't want it. I don't want to catch it. I don't want to be infected. So that's it. That's the conversation. Like, I don't care if you believe it's man-made or not. Do you want it? No. Okay, then we're on the same page. That's it. You know.
But it's crazy because I just wanted to know how many people are gonna refuse the stimulus that comes from the government that created the virus. I mean, seriously though, if it's a whole conspiracy, then the stimulus got to be part of that conspiracy. And are you going to refuse it?
Yeah, see you making too much sense. That's too logical right there. You know, they're gonna accept that $2,000 and suspension on student loan collection and a suspension on evictions and foreclosures. But yeah, the government is a conspiracy, all right. You know, and that's crazy. And then the stock market diving a few times and doing what it's doing. I mean, it's for people to go that route in their thinking. That's really crazy. That's really crazy, and it kind of tells you where we are collectively, and that's not a good look at all. But the watcher, I see you had your hand up. Yeah, the mic is yours. Hold up, what time? Let me see what time we got. All right, we have been an hour. All right, we could talk for a little while longer. I just don't want to be too long. But yeah, go ahead.
Peace to the panel, peace to the chat. I don't know how long y'all been on, but yeah, I just woke up and got the notification before I was about to head out. Yeah, on that, people getting those checks, I hope they realize that they can run, they're happy with it now, but they're still going to hit your taxes, and they're going to expect you to pay taxes on that afterwards. And when you said the comment about the people aren't talking about it, I was going to ask you if you were familiar with Riz Islam. Like, I tried to post a link in the chat, but I guess since I don't have a wrench, it didn't show up. But there's actually people who are having nice little discussions with the pseudo conversation about it being conspiracy. And I just wanted to know if you've seen it and if y'all discussed it, because it would have led to more conversation upon the topic.
Yeah, no, I didn't bring it up specifically, but I have seen a couple of those, and I think from Riza Islam as well. I mean, specifically, and it's, I don't know, man. I try not to be pessimistic when it comes to us the collective us, the we.
Right.
But man, it's like you can't help. It's almost like you. Sometimes I'm like, man, you might as well throw in a towel and go to Disney World or something, because it's almost no hope. I'm like, man, we are doomed. If this is the mentality of some of the things I've seen, and I watch for that. I watch how, because I look at misinformation as a virus too, as a metaphoric virus, and that that can spread. And when you get people infected and think that way, we need to start quarantining. And it may sound funny to do it, but that's a perfect analogy. And I always use that analogy for information, because what the rate of what you know versus, or I guess the ratio of what you know versus what you don't know, is the basis for your behavior. And so if you live in ignorance, and that ratio is high, that number is high, then you're going to have ignorant actions and ignorant behavior. You're going to behave based on not knowing. Even if you don't mean any ill intent or malicious anything, you got the good heart and the whole nine, you still may just do things that are just non-productive and destructive and detrimental, and not even know it or not even mean it or any of that. And we got to be careful of that. So I look at information the same way. But you brought up that and I guess that brother, I've seen a lot of videos similar, and I sit back and I'm like, wow, it's crazy out here, man. It's crazy out here in the internet streets. It is. That's how come, I don't know. I have this kind of no tolerance attitude. I just cut it straight to it. I like to have fun, but I like to have fun. Having fun should never compromise progress. And sometimes it's almost like this. It's almost, you ever watch a football game and a running back will break the line and he'll run to the goal and almost be there. Then he'll show off and showboat before crossing the goal line, not seeing the person behind him, and then he gets tackled and never make it into the end zone. That's what I see some people do when it comes to information and having fun, because it's good to have fun, but it's a way that it should be done. And I see people compromise progress for having fun or getting involved with things that take things in a different direction. So me, I don't have that attitude, because I see us as being so far behind. We're so far behind in terms of information. Our collective body of knowledge is not up to par. On a global stage, we are behind. We're down, low, or behind, however you want to see it. So we don't have time to be playing. And if we want to play and have fun, it better be exponentially sensible to the progress we make. So if we were to give it numbers, we better make a progress of 10, and then we can joke a number 2. You see? But you can't progress 2 and then joke a number 10. That makes no sense. So it's relative, That's how I see it. So that's me. That maybe some of y'all who kind of know a little of me or whatever, that kind of explain my attitude sometimes. I had this kind of no tolerance, but I'm patient though. I tolerate to an extent. So, but anyway, yeah, this coronavirus though. I'm trying to think whatever else that my sister was saying that stuck out. Let's see. I took some notes down. Aerosol. I already mentioned that. The perfect carriers, asymptomatic people. Yeah, I mean, and then people are judging it by the death toll instead of the infection rate. And it's spreading. Yeah, I covered everything that endemic. There's some reports or speculation that the coronavirus may become endemic, which means that it will become a seasonal or regular flu bug in the population. And another thing that people need to look into is ways to suppress the virus. So the flu sticks around because it mutates, but this virus is specific and it hasn't shown those signs as of yet, at least to my knowledge. And so to reduce the spread of infection and to reduce its lifespan, just period, is people need to look into herd immunity. So when they do develop a vaccine or whatever the case is, that herd immunity will kick in and it will kill off the virus. The virus won't have any hosts to infect and then multiply and survive, And so people need to start looking into that. Get up on herd immunity. What that's all about, and whether it could be endemic, which means that it'll be a regular occurring flu, like how the common cold is, or whatever. So keep all that stuff in mind and look into why we have a thing called the flu season. Like, I don't know if y'all ever asked yourself or looked into it. Like, why is there a flu season? Like, how is it that we can put a period of time to flus, and it's usually in the wintertime, and there's a reason for that. There's a couple of reasons, and some people know the surface reasons, but they may not know and understand how the immune system works and the contribution that vitamin D3 has to the immune system. And because in the winter months, depending on where you live on the planet, you have less sun exposure or UVB rays. You're not exposed to those rays as much, where you're not synthesizing vitamin D as much, which means that you're vitamin D deficient. And because vitamin D plays a key role in your immune system, then your immune system won't be performing optimally or be compromised. And therefore, these flu bugs you get, they will have time to proliferate in your body, and you'll suffer these symptoms before your body kicks in with all these different warrior cells that it does. And that's why you get the flu at a certain period of time. Because in wintertime, the angle of the sun, you're not going to be exposed to those UVB rays like we are in the summertime. So that's some things that people need to look into. All those good things, and the role nutrition plays overall. And I see people that downplay nutrition, and that's crazy to me, because they're, no food is ever going to directly kill, combat against pathogens coming in your body. That's what your immune system is for. But you have to have an optimal immune system, which takes nutrients as resources to develop all these different cells, all the different kind of cells, and for them to function properly is based on your nutrition, what you supply your body with. So for those people who rule out nutrition, man, they're crazy. They are absolutely crazy. And then just to be physically fit, and that's another thing. What I forgot to mention, not only are minors considered perfect carriers, but athletes are perfect carriers as well, because athletes tend to be asymptomatic as well, because they're fit, and their lymphatic system, the lymph is constantly in motion, and if people are not too familiar with the lymph and whatnot, is that, it's a fluid system, but it doesn't have a pump to pump throughout the body like the heart pumps the circulatory or the blood. And so you actually have to move in order to circulate your lymph. And that's where your immune system thrives, in your lymph. And for that to function properly, you have to be moving. So a lot of athletes have, their immune systems are pretty optimal. And so they become perfect carriers because they have, little or suppressed symptoms, or they just totally asymptomatic. And so but they're infected and they can pass it on, but they don't show symptoms, or it's minor, or they have a very fast recovery. And I think there's a couple of news reports about that. A couple of NBA players, I think. Even soccer, football, they call it football. We call it soccer. But some of the football players or soccer players, I believe, if y'all into soccer or football, if y'all are Arsenal fans or whatever, I think the one of the major coaches tested positive, but he recovered, pretty quickly, or whatever the case is. So anyway, I'm just kind of just rambling, but telling y'all a couple of things to look into, and spread the word though. Each one teach one about this stuff. Oh, Renegade, he says, did you respond to my question? Oh, let me scroll up. I didn't see your question. Oh, what field is your sister in? Because my parents are doctors and pharmacists, but their Nigerian side taking control in reaction to this COVID-19. What field she in? She's a nurse and she's in urgent care. She teaches, but she's in urgent care. So she sees patients. So she's like right there at ground zero. She sees patients. She draws their blood and swab and everything, about urgent care or whatever. So I think she's a general nurse. I think nurse practitioner. I don't know her exact title, but she can prescribe, this and that and do intake and all that kind of stuff. So, and then her husband, my brother-in-law, he's a full fledged OBGYN. He does all the stuff, everything with women. So yeah, but that's if that answers your question. But yeah, anybody on the panel, I'm hogging the mic, but anybody else?
actually heard Kevin Durant. Well, I ain't gonna say I heard. He has it.
Oh,
uh,
okay.
Coronavirus. But I'm not sure if he is asymptomatic or if he was actually having symptoms. But I guess a lot of athletes probably, if they have not been diagnosed with it, maybe will be because of how frequently they travel. Um, but
Yeah,
yeah,
that's the
I know
thing.
we've had recent recent, I guess they call it um community cases where pretty much they can't trace um where the people came into interact where they came into contact with the virus. Like I guess most of the cases that were reported, they could, track it through travel outside the country or, a recent cruise that they've been on. But I know our community cases in Minneapolis are growing, well, in this area, period. But the county I stay in has the highest instances of the virus and the highest instances of cases um, that happened outside of travel or having a place to trace it to, like interaction with somebody that had the virus. They kind of just don't really know where it came from. And I guess that's they're saying that's where kind of the more dangerous um, side comes in once you kind of lose track of how the virus is being transferred. It becomes a little harder to control, which is what they knew was going to happen, but it's just they're starting to see more instances of that.
Yeah, that's important. Yeah, that's important because that's what's alarming right now. And what's is it coincides with the testing that's now available that wasn't at first, and so the numbers are changing, and people are being alarmed at the numbers. That I've actually talked to someone who actually thought that the jump in number was the people, reflected the fact that these people got infected, within the 24 hours. But no, it's the fact that these testing facilities are becoming more available and more, proficient at what they're doing. And the numbers are going to change even more. I was looking up the numbers right now. There's a couple of websites you can look for, like coronavirus statistics in the U.S. I think right now, there in the United States, there's 9,464 cases and 155 deaths as of 4 hours ago. According to what I'm looking at right now. So, and see, people are looking at it. Okay, only 155 people died. 10,000 people died from the flu so far out of the year, and you can't do that. You can't compare that because the flu is widespread, and the coronavirus at the rate, man. And what's alarming is that people don't know how they have become infected. It's popping up, and it's like, oh wow, So, and as of today, I also saw a report from a medical study. I guess it's preliminary for now, but it comes out of China. But they observed that people with a certain blood type are more prone to have more severe symptoms. So it was blood type A and blood type O. Blood type O, less symptoms. Blood type A, more symptoms. And that can kind of get into the whole okay, black people versus white people type of thing, or whatever the case is. I can see now by tomorrow somebody's gonna make that argument. Black is type O, blood O, and white is type A. There you go. I could already hear it in my head. It's crazy. But so we need to monitor that as well. But this is new. This is new to me. I'm being careful. And like I said, I have allergies, so this is right at the season when I start, having all these allergy symptoms. I'm like, man, And some of the allergy symptoms overlap with what's being reported for the coronavirus and the common cold. They have these charts where they compare the symptoms of the common cold, the flu, coronavirus, and allergies. And I'm like, man, a lot of these things are crisscrossing, overlapping. So I'm trying to be extra careful. Anybody sneeze, I'm like, I'm out of there. I'm done. I'm out. So, but anyway, I guess any last, cause we kind of been, holding it down on the panel. I see the chat. I appreciate anybody tuned in. It's late night. This is a late night, Corona quarantine conversation, I guess. Out the blue, I just wanted to go live just to check on people, see what's going on in your hometown. I'm in Georgia. Like I said, all the schools are closed. And what else? Gatherings are closed. I think gatherings over 50 are closed. Like restaurants, they like taking takeouts, no sit-ins and stuff like that, pretty much. But yeah, so the Watcher, I don't know if you had anything else, because I think you were gonna say some other stuff.
Yeah, I raised my hand, but then you touched on some of the stuff I was gonna say, and I put it down. But then since you asked about like just to get demographics or find out what's going on in different areas, I'm in Phoenix, Arizona, and the weird thing about it is a lot of people that I know were sick maybe like a month and a half ago, like bad out of everywhere. Because like I got sick, my daughter, she had 103-degree temperature for like 3 days. My wife went down, like we all went down at the same time. A lot of people that I work with, everybody was like down, like everyone saying like, this is weird. I never had this type of stuff. And everybody, even the pediatrician, everyone's saying some sort of flu and stuff. So, and again, and we went to Phoenix Suns games, and it's weird to me because I guess one of the first basketball players, Rudy Gobert, I think, I don't remember his name, but he was sick and they didn't know what it was. And he's joking around touching the mics, and he started touching all the reporters' microphones. You know how they put them on the table when they're questioning them post game?
Yeah.
Okay, so he was like touching on it and joking and stuff. And, pre-game, they're walking around and they're touching the fans and they're dabbing up the players and hugging the opposing coaches and the opposing team and stuff. But it's just people think it's a sickness. And I was having a conversation with Bias. It's like, I'm not trying to put anybody at ease, but I wouldn't be surprised that majority of the people, or a lot of people, already came in contact with it, and if not had it, because we didn't have the abilities or the testing equipment or even the knowledge to understand what it was. And it's not even surprising to me that so many basketball players were getting it, like a lot of players in the Utah Jazz and then Dallas, is because these teams played each other, and people are trying to quarantine it to a certain amount of teams. But you got to recognize a lot of these teams had back-to-back, so they played teams the other day. And if it's that contagious as people are saying, it could have spread that fast, because you got to recognize when you're going in those big arenas and people are sweating and they're touching each other after the game and people want the headbands and sweatbands and high fives and all that, it can just sweep right through.
Yeah. And that's what I'm saying. So people got to understand how it spreads. So, I kind of discussed that earlier. The 4 to 6 foot radius of the, what's it called, the respiratory droplets, the cloud that's created from a cough or a sneeze. How you can actually walk into that, or, it will get on the surface. You touch it, then you touch your mouth, your nose, your eyes, where these ACE2 receptors are, and then it enters your body. That's like the gateway for the virus and things like that. So I kind of touched on that a bit. And so we just got to be really, really mindful and careful and not downplay it. Always err on the side of caution. That's my thing. And, all these conspiracy theories and stuff, like that's really a waste of time, because like I said, I end that conversation real quick. If somebody start bringing up that man-made laboratory stuff, I literally ask them, whether you believe that and whether that's true or not, do you want it? And everybody ever asked that, say no. I said, okay, we're on the same page. I don't want it. So it don't matter where it came from, right? Do you want it? Everybody say no. So it's like, all right, well, what you doing to not get it? That's it. I mean, to argue with somebody, whether it's man-made or not, or whether, what's his name? Darren Coots or whatever, the predicted it in his sci-fi novel, or Sylvia Brown, the psychic uh, woman, whether she predicted it. I mean, those conversations are a waste of time. You know, it's like, do you want it? The answer is no. Then we on the same page. So, what can we do not to get it? That's it. Let's agree on that, and that's it. So all this need to be discussed and everything. But I don't want to hold everybody up. It's like real late. So I know people need to get their rest and everything. Been on here for an hour and a half exactly. This is a good time to go ahead and end the show. But I appreciate everybody tuning in. Like I said, it's out the blue conversation. Take the time out to hang with a brother. Peace to the chat. I see brother Nahisi, Asar Mutep, Chavis, June out there. Now I know June is out there in Seattle, I think, Washington. And I all along June was sharing information with us about what's going on there. So Seattle, that West Coast was like the epicenter of everything. So they caught everything, the first wave of everything. I think the first case was reported out there. So shout out to June. Yeah, June gotta be safe out there. But all right, so I'm gonna shut it down. Anybody got any last words?
Peace. Good night.
Yeah, I was gonna say that in some countries they're actually taking really really tight measures. Like I know that in France they have it so serious where I think they deployed 100,000 law enforcement in the street, and they actually fine you if you leave your house without signing off a legal document, online from the I forget what ministry, but you literally have to sign a legal document stating from a list of the things that they give you, which they call emergencies for you to leave the house or necessities. You have to write that. If you don't, then they fine you. I think they started fining somewhere which was equivalent to like $40, but now it's like triple that much. So they're really not playing with that stuff. So you're told to quarantine, and if you leave the house, that you have to literally write why you're leaving the house. And I think that's good because well, it seems like it's going too far, but I was reading St. June's comment on the chat where it was like somebody was coughing near him and he took off running. But like, because these are the things you have to do when you're around people, and some people really don't. You don't know who's really who's protecting themselves and the people around them, because some people really don't care. So some places they're taking it serious.
Yeah, I think actually I think that they should definitely take more precautions, because like this past weekend it was absolutely crazy how many people were still out in bars turning up, and I mean, it was just weird to me. I think um certain businesses should be fined if they still feel the need to remain open despite um, guidance that's been given by the CDC, the White House, our state governor. I just really think that more more measures should be taken um, to ensure the safety of everybody and to kind of minimize the spread, because giving the people the option to kind of just do it on their own is not really working out. Um, so, I mean, I would, I mean, maybe not as extreme as signing out, um, but at the same time, if that's what it takes, then it is what it is. But definitely, it's a lot more lax from where I am seeing the reaction that people are having.
Yeah, I think that's a good point. The lax, I've seen it too. I've seen people post up, people going skating, people, like you said, still turning up and stuff. I don't know. It's not enough seriousness. And like I said, I it's a couple of things we could cite for the reason for it. One big one is ignorance, just not knowing. But then the lack of experience, because this is the first time, like I said, me being, going back to my childhood, I remember chickenpox. It was like almost expected. And I could see how nonchalant my generation was with chickenpox. So I can imagine not really having to deal with anything like that, period, how nonchalant people would be. And then one thing we got to factor in, a lot of people distrust government, whether it's the state level, local level, or the CDC and stuff like that. A lot of people distrust government, and we're in a bad situation when you think that the government that affects your livelihood, if you think while you're living, if you think that they're out to get you, that's not a good state to be in or live in, period. A state of mind to be in. Here is this body of people that makes decisions that will affect your life directly or indirectly, and you think they're out to get you. So that's kind of crazy. So we gotta get it together. But if nobody else, I'm gonna go ahead and shut it down. I appreciate everybody coming on the panel and tuning in. And I'm gonna have these conversations, random. I do it random, so make sure if you're not subscribe, but make sure you click the bell to be notified, because I will pop up out the blue. I pop out of nowhere, be like, bam, just like who was that on In Living Color? Pop out those business cards, bam. That's how I'll be with these lives on these topics. Cause see, what inspires me is when I see certain things, I'll be like, okay. When I don't feel like typing a bunch of stuff on social media or Facebook or whatever, I'll just go live and discuss it. So, but I appreciate it. But I'm going to say peace to everybody. Have a good night. Y'all stay safe out there and spread the word. Encourage people to learn to